Hi, my name is Anna Harper. I'm a pediatric nurse practitioner student, and I'm going to perform the head, ears, eyes, nose, and throat exam. So this is my patient, Steve, and he's a 32-year-old male who has kindly given his time to do this video with me. So before we start, we went ahead and did the Snellen and Rosenbaum tests, and the Snellen test for distance vision and the Rosenbaum test for near vision, and both of those tests test cranial nerve 2, which is the optic nerve. So while we start, we're going to go ahead and cover your right eye. Here we're just checking for nystagmus. Go ahead and take that off and cover your left eye. And his eyes are free of nystagmus. Now we're going to do the confrontation test. You're going to cover your right eye. I'm going to cover my left. And I want you to tell me when you see, look at me, and I want you to tell me when you see my finger.
See it.
Okay? Next.
See it.
Okay. So that was a normal exam. Now I'm going to inspect and palpate his eyebrows for size, hair texture, and to make sure that his eyebrows touch the temporal canthus, which they do. So all of those are normal findings. I'm now going to look at his orbital area, make sure that he is free from edema and lesions. Close your eyes. Open. That was also normal. The insides of his eyelids, the conjunctiva and sclera were pinkish red, and no signs of lesions or edema. Now going to look at the external eye, and we also looked at that with the cover and uncover test. Going to inspect the lacrimal glands, making sure they're free of edema and any discharge, which they are. Now I'm going to test the extraocular muscles with the 6 fields of gaze and the corneal light reflex. So, follow my finger only. Okay, that was normal. No nystagmus, no jumping of the eyes. Now we're going to look with an ophthalmoscope for lens clarity and the red reflex and the retinal color. And the iris color is blue. We're going to look at this ear. Red reflex is there. Pupils react appropriately to light. And red reflex is there. Pupils dilate appropriately to light. Look at this ear again. Just checking dilation. Both of those were normal. Pupils were reactive and equal to light. Pupils were 3 millimeters. Next, we're going to move on to ears. So I'm inspecting the outside of the ears, behind the ears, and the inner canthus of the ears, noting color, position, nodules, swelling, size, and shape, and making sure that they're the same color as the rest of his body, which they are. Now I'm going to take a look inside his ears for any discharge, foreign bodies, color, any lesions noted. And that all looks good. tympanic membrane was a pearly gray color, no perforations, and mobility of the eardrum. During this whole assessment, I've been testing his hearing response to my questions. We're now going to do the Weber test, which tests sensory hearing. So I'm going to tap my thing here and put it on top of your head. I want you to tell me when you stop hearing it, making sure that it's equal in both ears.
Okay.
Was it equal in both?
Go.
Okay. We're now going to do the Rhine test, which tests air conduction versus bone conduction. When we put it behind the ear, we should hear it, and then when we move it in front of the ear, we should hear it for twice as long as we do on the bone.
Okay. Okay.
Now I'm going to test the other side.
Okay. Okay.
All right, so that test was also normal. We're now going to do the whisper test. So I need you to cover your right ear. I'm going to whisper, and you tell me what you hear. A.
A.
He does have some hearing loss from the military. B.
B. X.
Okay, he didn't get that last one. Now we're going to do the other side. A.
A.
P.
P.
Z.
Z.
Okay, so we have some hearing loss in that right ear. We're now going on to the nose. I'm going to inspect the outside of the nose for any displacement, palpate for any masses or tenderness. Do you have any tenderness in your nose?
Nope.
Okay. We're going to check for patency. Looks good. Nasal septum is clear from blockage. There's no nasal mucosa, no discharge. And now we're going to palpate the sinuses for tenderness and swelling. Any pain there?
Nope.
Pain there?
Nope.
Okay, so that's a normal finding. We're now going to move on to the throat. Kind of feel for any enlarged lymph nodes here and down in the clavicle area and in the back of the neck. Looking at lips, making sure they're symmetrical, colored, no discharge or lesions. Then we'll look inside the mouth, looking at the teeth, making sure we don't have any missing teeth or occlusions. Teeth. We do have one missing tooth and some fillings, but all those can be normal findings. The gingiva is pink and moist, no tenderness or lesions noted. The tongue was pink, symmetrical, no lesions or swelling or ulcerations. Then we're going to test the cranial nerve 10, which is the hypoglossal cranial nerve. And by testing this, we're going to ask the patient to stick out their tongue and stick it in and out quick. Okay? And then I want you to stick it out and move it side to side. Okay? And then I want you to stick it into your cheek, and I'm going to push on it. Okay? Another side. Okay? And then lastly, we would look at the tonsils. And my patient today does not have any tonsils, but the uvula hangs midline, no redness or swelling, and of course, no tonsils. And then lastly, I would check the gag reflex with my tongue depressor. So, thanks for watching.